I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist Yves Gege of Made to Move Physical Therapy, and we want to talk about shoulder impingement and show you some exercises you can do to get over it. Now, shoulder impingement is really common. If you're in your late 20s, 30s, 40s, and you do some repetitive activity or sport, you're probably going to have aches and pains reaching up into overhead activities or out away from your body. But there's some simple things you can do to get over that before you need an MRI or certainly before you need surgery. So that's what we're going to talk about and show you today.
So many people with shoulder impingement just have tight shoulders, right? They need to get more motion to kind of loosen up that joint. So we love to give people these simple 3 exercises they can do anywhere, even at home. So the first one is working on shoulder internal rotation. So I'll let you check this out. So let's turn around, back facing. We're going to actually bring your arm behind your back. Okay, and we're going to pretend the right arm is the arm that's tight. And you're going to use your left arm to help push it higher up in the shoulder. You'll usually feel a little bit of a stretch actually in the front of your shoulder with this exercise. Yeah, and you'll hold that anywhere from 30 seconds to a minute. And this one's great. I invite people to do this multiple times throughout the day.
And you just hold it in a position like this for that period of time?
Yeah, absolutely. And you should feel it loosen up, and then you can start creeping it up just a little bit more.
Okay, and they're just going to where it sort of feels tight, not real sharp pain?
Right. If you start to feel sharp pain, for sure, I would back off. You want an uncomfortable level. I usually tell people a 2 or 3 is about the max. Pain level out of 10.
I can see that.
Yeah.
And that's probably a little more reproducible than trying to do some of these sleeper stretches, which can be great, but you got to make sure you do it right.
Right. Okay. You don't want to have to get on the ground. It's just like too cumbersome. I want people to comply to the exercise program. This is a super easy way to do that.
Cool.
Yeah.
All right, what else you got?
So, as you said, it gets painful sometimes lifting overhead. That's when we feel that impingement. So we want to actually work that range of motion. So we'll use the rig here, but this could be easily done in a doorway in your home as well. Okay, so if we come up to the rig, we're going to do it with your right arm. And we're just going to slide your arm up as far as you can go. And the same thing as before, we want to get to the point where we feel just a little bit of a stretch in the shoulder. We want to avoid those sharp pains.
Am I leaning into it?
Yes, right? Because you're going to get to the point where that arm is outstretched as possible, and that's when you need to start to lean to it a little bit more. I tell people you want to get that elbow as straight as possible first, and if you can clear that without pain, then it's a very gentle kind of push where I tell people their armpit could touch the rig, or if you're at home, touch the doorway, and that's when we get to a point where we got some full range of motion and we're feeling good.
Yeah, because most people with shoulder impingement, they're fine to about here, maybe here, but then that last 20, 30 degrees is just miserable.
Right.
So I can see why that would be quickly helpful.
Yeah, no, absolutely.
It may not be the most fun thing you've ever done, but I can absolutely see that. All right, cool.
Yeah, it's a pretty slow progression too. So we worked in some range of motion. Obviously what's super important in the shoulder is shoulder stability and strength. So, everybody kind of knows these TheraBand exercises. So we're going to show you kind of our version that we use at Made to Move, which we really, really like. So instead of your normal exercises where we're here and we're rotating out, we're actually going to hold this position here and then use our body and walk back and forth for about 5 reps. So the big thing here is our wrist, elbow, and shoulder all stay in alignment, and we're going to start walking back and forth. I usually tell people 2 steps in, 2 steps out. Give that a shot.
So when you say in alignment, elbow sort of against your body, hands straight ahead type of thing at 90 degrees?
Exactly. You'll probably start to notice that band's going to want to pull your wrist in, right? And we want to fight that and make sure we stay in a, neutral position. How's that feeling?
Oh, I like it.
Yeah. Feel a little bit of burn right through here?
But it's not, because you just don't actually have that much strength doing that. And so a lot of times people end up, to do it, they're using all these accessory muscles. I think this is actually working what you're trying to work. I like that a lot.
Yeah, we want that shoulder to be as stable as possible. That's some of the theory behind shoulder impingement is just there's not a lot of stability there, right? So this should help some of the pain. Believe it or not, we've done this for people who are in pain, and we say, hey, try this exercise, and all of a sudden they can lift a little bit further overhead without pain, which is really cool.
And what kind of resistance? Would you tell people to go with a lighter resistance rather than the really heavy bands?
Yeah, start with anywhere from like 3 to 5 pounds is where I would start, and then progress your way to the point of 10, 15 pounds max.
Okay. And when you do, what you're doing, 30 seconds, 60 seconds, like what's the timeline?
Yeah, I would say I like 2 steps out and 2 steps in, making sure you have resistance the whole way through. And I usually tell people anywhere from like 5 to 6 reps back and forth.
Awesome. Well, these were great. I tell you, this is so common. It's such a common injury. Very often we can get you better without surgery, so try these kinds of things first. If you're not getting better, absolutely go see a doctor, go see a physical therapist. But these are simple things. You saw it takes very little equipment, and these bands, you could get them, very cheap and do a lot of this at home. So check these out, try them, every day for a few weeks, see how it goes, and then decide if you're getting better. If you like more videos like this, click the link below. Also check out Yves' physical therapy site for much more great information on rehabbing injuries and ways to stay healthy. And we look forward to seeing you next time.